Hello, my name is Jesslyn Phelps, and I'm a student physical therapist at University of South Alabama. Today, I'm going to be presenting our journal club presentation on joint attention and yoga as it relates to autism spectrum disorder, or ASD. So the title of this article is Effects of a Creative Yoga Intervention on the Joint Attention and Social Communication Skills, as well as Affective States of Children with Autism Spectrum Disorder. As you can see, the authors here, the journal entry is, or the journal that this came from is Research in Autism Spectrum Disorders, and the year of publication was 2021. So what is joint attention? I wanted to give some background on this before I get into more details about the article. So joint attention is the ability to share attention with others about objects or events in the environment. So this is a very social aspect of what can be a common impairment for autism or ASD. So some examples of this is a child pointing to a toy to draw their parents' attention to it. And this is spontaneous joint attention. Or and the other type is responsive joint attention, and this is where you're getting them to respond to something that you're pointing out to them. So it could be you pointing to a picture on the wall, and their response is looking at what you're pointing to. So the research study in question is a pilot study. And a pilot study is a preliminary study conducted specifically for the purposes of establishing if a full trial will be feasible to conduct or if all the necessary components of the trial will work properly together. So basically, this is just a small scale type of study before they go on to the large scale, just to see if this is feasible and if it's going to work, if they put the time, money, and effort into making one larger. Okay, so the research study design for this was they took 24 children with moderate to high severity of autism and were split into two groups. The academic group served as the comparison group, and these were children with ASD that were already enrolled within this standard of care for these researchers, and they were involved in another previous trial that these researchers had performed of a different pilot study for a randomized control trial. And for this group, the interventions were tabletop play activities that promote fine motor and communication skills by reading, building, and arts and crafts. The yoga group were recruited by flyers at local schools, clinical services, and online postings. So they were not already in these researchers' plan of care. So their creative yoga is different from regular yoga in that the key components of the yoga were made fun and creative using age-appropriate songs, stories, games, and props to further engage the children. The study lasted 10 weeks, so pre and post test sessions in the first and 10th week, and 8 weeks of intervention from 2nd to 9th week of participation. For level of evidence of this, I gave it a rating of a level 3 evidence because it is a well-designed control trial, but there is no randomization. They were using the children that were already recruited before prior to in another trial, and they put them into the academic group, and then they recruited more children for the yoga group. Therefore, there was no randomization. The participants themselves, so the inclusion criteria was they have to be 5 to 13 years old. They had school or medical record confirming their ASD diagnosis or social communication delay on the SCQ. And they also followed the Autism Diagnostic Observation Schedule, 2nd edition criteria met for ASD as well. The exclusion criteria was significant behavioral problems. So this could have been aggression, non-compliance, or the inability to stay on task. And these were established based on their performance in their pre-test session. And same for receptive communication impairments, in that these were also established in the pre-test session. And this would have been their inability to follow simple two-step commands. And they were also excluded if the child could not complete 50% of the intervention session. So if they didn't come the full 8 weeks of intervention, or if they came half of that, excuse me. So the primary data collection instrument that they used for this was a joint attention test, or the JTAT, and they use this to assess, it's used to assess changes in responsive joint attention in school-aged children. And this is a standardized outcome measure. So the specific things that they looked at for this were the response scores on the JTAT, the Q level scores, the socially directed verbal communication, as well as the affective behavioral states. For the data analysis, they primarily use the analysis of variance, or ANOVA, and they use this to look at the total JTAT score. To further analyze the ANOVA, they also use Mauchly's test of sphericity and greenhouse geyser corrections, and they applied this in case of any violations from the ANOVA. They also performed post hoc comparisons for main interaction effects. They used the Bonferroni corrections, and these were applied if there were 3 or more post hoc comparisons. And they use Cohen's D to report within or between group effect sizes. So the results themselves, the JTAT results were that there was a significant main effect of pre-post-test sessions with no group interactions. And they also performed post hoc for main effects, and this indicated that children improved their total JTAT scores and post-test compared to pre-test session following both interventions. So both the academic group and the yoga group improved their JTAT scores after intervention. Specifically into this, they looked into socially directed verbal communication. So they looked at spontaneous and responsive verbal communication, and these were the different times that they looked at these for it. So essentially what all of this means is that though both of them improved throughout the trial or the intervention for this, for their social verbalization, there is greater improvement in the yoga group versus in comparison to the academic group. So there was more social verbalization, both spontaneous and responsive, for the yoga group. For affective behavioral state, there were no significant interactions involving the groups. So children in both groups did not change their affective states before or following intervention. However, the yoga intervention evoked more interested effect and less negative effect compared to the academic group. So there were some slightly positive changes for the yoga group, but they were not statistically significant to raise these scores very much. But there were some positive effects. Okay. So article appraisal for this one, some of the strengths for it is that they did use a comparison group so they can see if one is more superior to the other. They did collect demographic information, and they established that all children that were in each group were there were no statistical differences between them. Level of functioning was established at the beginning of this, so it makes it easier to understand what severity of ASD this could be applied to. And they use valid measurements or outcome measures to establish their criteria or to follow their measurements. Some weaknesses with this was that it was a small sample size. Again, since it's a pilot study, they can't use a large sample size. Therefore, it can't have much statistical power. There was a wide age range, so it makes it harder to hone in on if there were differences between ages that for future studies, perhaps, like if there was more of a difference between the 5-year-olds versus the 13-year-olds. There was no random assignment for them, which could affect it as well, because randomized control trials are better in this aspect for bias and whatnot. There was no follow-up tests, so there was no way to know if there were any significant long-term effects after intervention was ceased, see if there was more improvements after the fact. And there were also no medical history performed on the children. So they didn't know of any medications, any comorbidities, or their diagnostic history, which all these could affect their responses to these different interventions. So our take-home message for this, I think for therapy set for us as therapists, is that creative yoga has a lot of multi-system effects. So you can hit multiple birds with one stone, so to speak. So you can help improve joint attention, maybe even affective states as well, and socially directed verbal communication skills because they're more engaged with it. And it also helps with gross motor skills because they're up and moving and following these movements that they're doing, that they're imitating, which also helps with bilateral coordination and task-related imitation performance since they are modeling after somebody. Right. And these are my references. Thank you so much for listening, and I hope you enjoyed my presentation.